Hi, everyone. Thank you for joining us for our session today on navigating the hidden costs in your practice, strategies for financial stability and quality care in 2025. As primary care practices face mounting pressures in 2025, hidden costs such as fragmented systems, revenue cycle inefficiencies, and clinician burnout threaten both financial stability and quality of care. This webinar will provide you with actionable insights to overcome these challenges. On the next slide, you'll see our learning objectives for today's session. We will focus on identifying workflow inefficiencies and explore how integrated technology can streamline operations. We'll discuss the impact of excessive documentation and discuss AI tools that support clinician well-being. And lastly, enabling you to evaluate various payment structures to determine the best fit for enhancing financial health and care quality. Before we get into today's content, I'd like to introduce myself and my colleague from Elation Health. My name is Manisha Goud, and I'm Vice President of Solutions at Elation Health. In my 10 plus years in healthcare, I've focused on ensuring clinicians, operators, and their organizations have the tools they need to drive clinical and financial outcomes. Through this, I've worked across the payment and care delivery model spectrum, including traditional fee-for-service, direct primary care models, and advanced value-based care arrangements. I'll hand it over to my colleague, Dr. Sara Pastoor, to introduce herself and kick off today's agenda.
Hello, everyone. Thanks so much for joining us today. So I am Sara Pastoor, and I'm a family physician and the head of primary care advancement at Elation Health. I have been clinically active for 26 years and remain clinically active today, and have had many roles, including primary care leadership in military medicine, academic medicine, and also currently work in private practice and have experience working in direct-to-employer delivery models. I am a fierce primary care champion and have spent a lot of my career really trying to optimize patient-centered workflow, EHR workflows, and transform our health system to one that is patient-centered and promotes health. And so we're going to move into the story or the origin story of Elation, which is really quite an interesting one. And it starts with a solo family medicine practice in California, where Kina and Kanan Fong, a brother and sister team, wanted to help their father, Dr. Dennis Fong, transition his practice and modernize it from paper records to digital. And they looked at all the EHRs that were available and really felt like nothing fit his style of comprehensive whole person longitudinal primary care. And so they really saw a gap in the industry and decided to build a clinical first primary care focused EHR. And they as much built it for their father as they built it with him. And so that user-focused, clinical-first design philosophy remains the way we develop and design our technology today. So fast forward to today, and we have 36,000 clinical users across all 50 states, caring for 18 million patients. And we remain the leading technology platform for high-value primary care. But what I want you to hear today is that Elation is more than an EHR company. We really are mission focused on rescuing independent primary care in America. And our vision is a future where primary care owns its powerful role in healthcare and every patient has a doctor they trust. So let's talk about fragmentation in your practice. And, one of the things that is a key focus is creating cohesive workflows. Fragmented systems that you're using in your practice side by side that don't integrate with each other or don't integrate well or perhaps are duplicating work are one of the leading causes of wasted time and resources in primary care. these disconnected tools then lead to a lot of inefficiencies and increase your overhead, result in longer work days, actually delay care, and can be frustrated for everyone working in your practice. And so, what we want to talk to you about today is embracing integrated technology platforms, all in one solutions, and other types of solutions that will really help you streamline your operations, decrease your total cost of ownership, and improve morale. And so the benefits of doing that are that you get bidirectional patient information exchange, you simplify your workflows, and you, of course, reduce that administrative overhead, as I mentioned, and you improve communication both within your practice and between other collaborators and your practice. And then you have more time to focus on patient care and do what really matters. Burnout is a huge problem in healthcare in general and in primary care specifically. We know that excessive administrative tasks, red tape, bureaucracy, a lot of unnecessary cognitive load, primarily driven by EHRs that are built to be all things to all users, and poorly informed clinical thinking when you don't have all the information that you need to make good clinical decisions. All of these things directly correlate with morale and productivity. And the impact is that we are inflating labor costs through redundant, repetitive tasks that could be automated and distracting from patient care when we really ought to be focusing on the patient, but we're too busy taking care of administrative tasks or getting lost inside the EHR looking for the information that we need. And it's so stressful that it can actually increase turnover rates, which again increases your total cost of ownership of your practice. And then one of the most frustrating things for me is this high noise, low signal information. And so I have a lot of junk to sort through just to find the nuggets of information that are really valuable to me in my clinical decision making and the management of my patient. And that creates excessive toil. It distracts me from my primary effort and often causes me to miss crucial information about my patient. All of this compromises morale, can drive down productivity and efficiency, and actually creates obstacles to clinical excellence. But there are solutions, and so we're going to talk to you about those today. We've heard a lot lately about AI scribes, and those are powerful tools. But what I want you to hear today is that AI can do so much more to empower your practice, both operationally and clinically, beyond the ambient scribe. And primary care of the future really is a team sport. And so figuring out how to leverage the various members of your team to do the things that they are uniquely trained to do and to remove the obstacle of the primary care physician being the bottleneck through which everything has to flow in order to be delegated to someone else, through this protocol-driven delegation of tasks and even automation of delegation of tasks through technology really is the way of the future. Nobody likes coding, and at Elation we say that doing is documenting, and so the right EHR actually is designed to auto code for the work that you're doing so that you don't even have to think about or hunt for the right codes that are needed. And so that captures all of the work that you've done and ensures that you get credit and then paid for it. All-in-one solutions that have the billing service that you need, the AI that you need, the ability to capture and bill for chronic care management, remote patient monitoring, and other services built or baked into the EHR are really the best way to go and a wonderful way to reduce that fragmentation of disconnected systems in your practice, reduce all of that extra duplicative work, reduce the saving of information in fragmented systems, and really streamline your workflows and improve the efficiency of your practice. So payment limitations can be a significant barrier to optimizing your practice, and it's so important to make sure that you align your payment model with whatever your practice's financial, clinical, and operational goals are. And so by selecting the right model, you can actually make sure that you are, by design, creating long-term success in your practice. And because we know that incentives really drive behavior. And so we want you to carefully assess the incentive structure that you have and choose the payment model that best supports your practice's goals. Fee for service, of course, is transactional. You provide a service, you get paid for that. It's really success is driven by volume and has no connection to incentivizing value or outcomes in any way. Direct pay is also transactional. That's where we're just paying cash instead of billing insurance. It can decrease your overhead because it's not as complex. You're not having to deal with a third-party payer. The relationship is directly between the patient and the practice. However, it remains transactional. So again, it's volume-based and not connected to value or clinical outcomes. Membership model is like a subscription. So you pay a monthly, quarterly, or annual fee that covers all services, unlimited, basically. Usually in the membership model, you have smaller patient panels. It's not volume driven. It's more of a direct relationship in terms of financial relationships between the practice and the patient. And you can spend more time with your patients. You can generally, because you have smaller panels, see them sooner, and maybe have same day or next day care when needed. Offer virtual solutions. You have a lot of freedom and flexibility in this model to innovate and deliver care that's truly patient-centered. And there's no reimbursement in this model that actually incentivizes any particular quality, but it does seem to be a more patient-centered way of delivering care, although the patient panels are smaller. Value-based care is an arrangement typically with an insurance company, and is designed to incentivize outcomes that are either process measures or even like total cost of care, things like that, that actually are, in theory at least, tied to producing better value in healthcare. And hybrid is defined as basically offering a fee-for-service model side by side with a membership model. So you may have some patients for whom you are billing insurance under a fee-for-service arrangement, and some patients with whom you have a direct payment relationship under a membership model. Concierge, on the other hand, the purest definition is where you are billing insurance and collecting a membership fee on all patients. And so you're collecting both types of revenue on a single patient. And this is a nice way to allow a patient to use their insurance to pay for care and decrease the fee associated with the membership model to increase the revenue to the practice. So just think about how you would like to incentivize things in your practice and what your practice goals are, and consider maybe innovating a little bit with your incentive structure, and get outside the fee-for-service box. So I can tell you, as a clinician practicing in primary care for many, many years, that there are solutions to burnout and fragmentation. And starting with synchronized technology workflows, having the right technology, the right tech stack, the right tech ecosystem where information is flowing bidirectionally and things feel seamless can really reduce friction in the workflow and greatly improve morale, reduce total cost of ownership, and improve efficiency and effectiveness in your clinical practice. I have been implementing AI in my clinical practice and am enjoying it tremendously. It is the most powerful and impactful piece of technology that I have experienced in all of my years in healthcare. And we're also seeing this be the most rapidly adopted technology that we've ever seen in healthcare. And honestly, it just feels like that finally we have technology that clinicians actually want. And so I'll just give you one example. Elation has an AI scribe tool that recently launched an enhancement called Actions. And as the AI scribe is listening to the encounter between me and my patient and crafting a well-organized SOAP note from that conversation, it is also capturing all of the orders and plan items that I discuss with my patient. So it may be to discontinue a medication, to start a new medication, to order labs, generate a referral, set a follow-up appointment, you name it. It captures every single one of those tasks. And so no longer do I have to like scribble down notes or type while my patient is sitting there watching me, or just hope, that my mental list doesn't get forgotten. And I think we've all had the experience where, the patient gets to the pharmacy and the prescription wasn't there, or we never did put the referral in and they're waiting and waiting and nothing's happening. And that creates a lot of downstream chaos that disrupts our workflow when we have to drop everything and fix the mistake of the thing that we forgot. And that this tool has erased all of that for me. So I love what AI is doing in my practice and feel very excited about what's to come next. I personally work in the direct primary care model, which is a membership model. I've also worked in direct to employer models, which is outside the insurance system, and have friends and colleagues who are working in the concierge model or the hybrid model, and also in value-based models. And I think all of these are better performing models than traditional fee-for-service. Fee-for-service has really been toxic to primary care. And I'm really excited about innovation in payment because I think to improve primary care, to make primary care a better experience for healthcare professionals and also for patients, and to actually get more value out of the healthcare dollars that we invest, innovating in payment arrangements is what needs to happen. So I actually have really enjoyed being able to work outside of that traditional fee-for-service and insurance-based system. And then, the path forward for primary care, modern primary care, is really going to be a multidisciplinary team-based model. There's nothing wrong with a physician working with a small, group of support staff. But in a multidisciplinary team where we have, perhaps health coaches, perhaps nurse case managers, perhaps someone from behavioral health, these really are very powerful models. I've been so fortunate to work in these models for most of my career, and it really changes how we can deliver care by wrapping so many additional skill sets around the patient to address so many other things that are outside my scope of practice as a family physician. And when you automate that and make sure that everyone knows what their job is, and we work together in a coordinated, synchronized fashion to deliver the best care possible for our patients, that's where we really, really start bending the cost curve and improving patient outcomes. So that's an exciting development that has been brewing for a while, and I think is really going to start taking root as our payment models begin to shift more towards value. So now I'm going to hand this over to Manisha, and we'll land the plane here and then step into some Q&A. Manisha?
Thanks, Dr. Pastoor. Now to talk through some of the business perspective of everything we've shared, whether your priority is reducing burnout, increasing revenue, or streamlining operations, or improving care quality. From my experience working with practices of various sizes across the country, optimizing your technology stack is at the heart of driving efficiencies across the board and will set you up for long-term success. Now, when we talk about moving towards a more integrated technology platform, that doesn't mean you have to be locked into a single vendor. In fact, many of the most successful practices and organizations that we work with use multiple vendors. The key is making sure that they're integrated and that each solution is truly best in breed for your organization's needs. When your systems are integrated, you reduce both actual and hidden costs. Data moves more smoothly, staff waste less time troubleshooting, and your operations become more efficient. When each system is aligned to a clear role in your care and business workflow, you avoid unnecessary overlap. And by doing so, you simplify vendor management and overhead. Communication becomes streamlined, support is more targeted, and issues are resolved faster. That efficiency opens up space for what really matters in practice sustainability, pursuing revenue generating initiatives that increase your revenue. Instead of spending time stitching together disconnected tools, your team can focus on streamlining operations that positively impact patient care and reduce burnout. It's all interconnected. Ultimately, a well integrated, best fit solutions technology stack drives more value and more dollars to your bottom line. It's about building a technology ecosystem that supports the way you deliver care and run your business with less friction and more flexibility. So, wrapping up today's session, we wanted to reemphasize some key takeaways from our discussion. First, hidden costs can undermine your practice's financial and operational health. Technology, workflows, and the right payment model are the essential trifecta for addressing these challenges. And as Dr. Pastoor mentioned, supporting clinician well-being and streamlining workflows leads ultimately to better patient care and improved practice success. So we'll leave you with this, a couple of questions and food for thought. If you could reclaim some of your hidden costs you are spending on disjointed systems, if you could find a payment model that better served the needs of your organization, and if you could improve clinician well-being by streamlining key workflows, what could you achieve for your practice and your patients? And with that, we'd like to open it up for some Q&A.
Great, thank you. I do see some questions coming in from our audience, and while these questions look really good, let me take the first one. So it says here, what are some early signs that a practice is suffering from workflow fragmentation? And I think you will hear this from everyone in the practice. They'll be complaining about how data is not transferring, how they have to do double documentation, how they wish that it would, that the information would flow from here to there, or the information would go into a different place. Um, and so you'll hear that stress in your practice, and those red flags that you know that you really have room to optimize. There's an opportunity there to maybe switch vendors or talk to vendors about improving their integration or switch to an all-in-one product. Um, Manisha, I think that the next question might be good for you. It says, how do you recommend practices start exploring new payment models without fully overhauling their operations?
That's great. That's a great question. Um, I'd say by starting off small. So try to identify a subset of patients or services where you could pilot a new payment model. A great example of this is chronic care management, also known as CCM. And we'd recommend, use existing staff and tools where possible, so you're not overhauling your entire operation. Track metrics that enable you to monitor your performance against the program, and then iterate based on that result. This can allow you to learn and adapt and try out new payment models without disrupting your entire operation.
Excellent. Let's see, the next one is, can you walk us through a real-world example of how AI documentation tools have improved clinician experience? Do you want me to take that one?
Yes, please, Dr. Pastor.
Okay. Well, so I can, speak to my own experience, and I can tell you that ever since I started using an AI scribe, instead of having the laptop between me and my patient, and I'm trying to type and gather a few notes and make sure that I am at least jotting down a few things so I don't forget while I'm talking to my patient, I don't worry about any of that anymore. I hit record, I set the laptop aside, and my patient and I just talk. I may need to look up something in the EHR once in a while, refer to something, but the patient and I are doing that together, and it's part of our conversation, not distracting from our conversation. So I love, love, love that. It actually creates a much more comprehensive note because I'm in a membership model. I can spend more time with my patients, and that creates a much bigger volume of documentation that would take me a long, long time to capture if I had to type it all myself. And so I tend to truncate those discussions, and I miss documenting probably some important nuances. And the AI scribe now has really corrected for that and creates a very comprehensive note that doesn't miss any of those nuances. And I really feel like I've got the documentation that I need. And then I mentioned earlier in our discussion about capturing actions, care plan actions, and this being sort of a hidden tax where we've got this downstream chaos to clean up. And it also really affects trust between my patient and me because I told them I would do a thing and then I didn't do the thing. And so that has been all corrected. And also, I so desperately want to do a good job for my patient. And when I forget those things and create hassle factor for them, that actually impacts how I feel about my own competence as a physician. And so I feel so much better about that now that I, have this partner in AI to capture all of those care plan items. And it's, sort of this power of never forgetting that has really transformed my experience with my patients. So the next question is, for practices that take insurance, how do you suggest they begin integrating a hybrid or concierge model without overwhelming their staff? You want to take that one, Manisha?
Yeah, thanks, Dr. Pastor. That's a great question. And similar to introducing new payment models, my advice here would also be start small. And you can do this by starting to offer portions of concierge style services. For example, extended visits or, direct 24-hour 7 patient messaging. And think of it as an optional add-on for a small and targeted patient group. Consider this a pilot and use it to understand how it's working, refine your workflows, pricing, and internal and external communication. Once you gain comfort in these service offerings, start to gradually scale this based on your staff capacity and patient interest.
Yep, that sounds right to me too. And then one more question I think we'll take, and then we'll wrap up. What metrics should practices track to evaluate if their technology investments are really reducing hidden costs? I think that's another good one for you, Manisha.
Thanks, Dr. Pastoor, and thanks for this question. And it goes back to how you're measuring actual costs and hidden costs. So metrics I'd recommend include um, staff time saved on administrative tasks, reductions in documentation backlog, reduction in billing errors or denial rates, and lower overtime costs. Other metrics that are really helpful, especially in understanding clinician burnout and satisfaction, are patient throughput, satisfaction scores for patients, and clinician burnout rates, which can be something you measure internally and specific to your practice. All those metrics can reveal both actual costs, excuse me, and hidden costs. And ideally, you're deriving those from technology investments and tips and tricks that you learned from today's session.
Excellent. So thank you so much, everyone, for joining us today. We enjoyed this opportunity to share some of our thoughts about hidden costs in your practice, and we hope that this has been helpful in some way. If you have questions or you want more information or you want to learn more about Elation, please visit our website at elationhealth.com, or you can email us at inquiries@elationhealth.com. Thanks so much again. Have a great day.